one more YouTube live and Instagram live. And right. So we start our again session, and I'll first start answering one of the questions, few questions on the WhatsApp group I got on my personal chat. So people wanted to know something about related to indignation. So now see what happens in rubric. If you basically want to prescribe on rubrics, it is very important to understand the exact meaning of the rubric so you don't make a mistake. That's important. For example, there are a lot of rubrics in our repertory where sometimes it becomes difficult for us to understand, and sometimes it becomes what you call difficult to interpret a rubric. And as I always say that in homeopathy, however knowledge you have of the mathematica or the organon, the most important thing is interpretation of the patient's symptom into the language of the repertory or the language of the mathematica. Now, for example, if you take the rubric indignation, you have seen in my YouTube, I think YouTube videos or Instagram, I have started a series of explanation of the rubrics which I have used in my practice, and I clearly have understood and prescribed with good results. Now, if you say indignation, now as you say indignation, there are some remedies which are very, very common in indignation. That is, the first remedy comes Staphylococcus. Then you have other remedies like Staph is there, Colocynth is there, Nux is there, or a metallic, and so on. Now, what exactly meaning of indignation, that is important. Welcome, Dr. Amulya, Dr. Chorsia, Dr. Alexander. What exact is the meaning of indignation? See, indignation is an intense and deep felt resentment or anger. See the words, remember the word resentment or anger. Why? By annoyance or displeasure. Means I am not happy with somebody, I am very annoyed with somebody because injustice has been done, or the person has suffered something wrong. Most of the time, I'll give an example. We have cases where the patient says that I am suffering from fevers in the past 1 or 2 months, and when I take the medicine, the fever is okay, but still there is a fever in my body. And when we trace the history, the patient says, "Yeah, I'm basically work in a office, and the boss always tries to let me down in front of my workers and all. I have also some esteem and ego also, no, but he always makes sure that he scolds me and makes me feel inferior in front of everybody. I don't feel nice because I have done nothing wrong. Still, he wants to show that he is the boss." And then when you prescribe on these symptoms and other symptom, you add few symptoms, and you can see how Staphylococcus or how Colocynth or how Arometallicum or how Naxomica beautiful comes out in the picture. That is the exact meaning of indignation. So I'll just finish the rubric explanation first, and then I'll get the topic, because there was a lot of questions about the rubrications. I hope you understood exact meaning of indignation. Or you can say, when the when a students or a person feel embarrassed, and which is felt, and because of he feels a deep sense of great resentment, and there is a constant thinking in his mind. He has sleeplessness, he has pain, he has turmoil because of that. And when you ask the case taking in detail, automatically this comes out. So indignation may cause any somatic symptoms in the body like sleeplessness or pain or turmoil or pain in the abdomen, nodules in the abdomen, tons, anything. But the indignation part is very, very important. Welcome, Dr. Madan. And with indignation, you must remember there are so many cross references, for that those are very, very important. For example, elements from embarrassment, elements from honor wounded, elements from rudeness or reproaches, mortification, sensitive to rudeness. These all rubrications you have to take into account the cross references, so that you don't make a mistake in your interpretation. Because I always say 2 or 3 rubrics, the case is through. So if you make a mistake in one rubric and then try to fit other rubrics because the medicines have come, then you basically land up in failure. If you would have heard my last webinar about 2-3 days back on the International Forum of Homeopathy, I presented a case where the remedies on the first repetition was very different, and when we failed, we repetized again, and absolutely a different remedy came, with the same case taking. So all to all, you must understand the art of interpretation is the key to your success in prescribing the simillimum. Yeah, welcome, Dr. Valin. Roy, sir, 130 years old, very sensitive to sunlight, headache, feels like loose motions. Cannot tolerate. Now, see, Dr. Roy, it's simple as that. If you just going with the sunlight symptom, and if you feel that that is the cause, so make ask the patient whether these sunlight symptoms have been developed now or it has been since a long time. So whenever you are suffering from chronic effect of sunstrokes or sun problem, then you can think of natrum carb. Otherwise, there are a lot of remedies for sunstrokes. To start with, you can think of natramur, glonine, amyl nitrate, antim crude. There are lots of remedies. So you can give, if there's chronic effect, you can start with natrum carb. Birawala, welcome. Dr. Madan, good afternoon. So one more question, sir. There will be left side sciatica better by pressure. Left sole there is burning pain. Colocynth and Macfox is given, but having more pain still. Please share the other remedies. So, Dr. Amulya, sciatica. See, when we are talking about sciatica, sometimes you know what happens that what the patient does in case of pain, what the patient does when he has sciatica pain, that also becomes very important. I will tell you the remedies, but I'm just telling, sometimes the patient comes and tells us, Doctor, what happened? I had a case, and she said that when I went in the school, it was basically a day where everybody had to dress up with a dress code, which I could not, I forgot. And in front of everybody, my HOD shouted me so much, humiliated me so much. After that, this sciatica pain started. And now the pain is very severe. It is tearing pain, aching pain, better by heart pressure and whatnot, she told me. Now, whether to take the symptom which are present of the pain, or you could take a fantastic rubric elements from humiliation or mortification, and automatically, we prescribed the remedy and the patient came out beautifully. But that remedy did not cover that part of pain. I prescribed that patient a single dose of chamomilla, and the patient was much, much better. No doubt, chamomilla has pain, chamomilla has sciatica pain also. But I was just trying to tell you. Now, if you want left-sided sciatica pain, you can write down the remedies. We have remedies calibicrome, calicarb, ammonium carb, hypericum. These are very, very important remedies. In fact, if you go to see chamomilla also, chamomilla is left-sided. So this is how you have to prescribe in those cases. If Macfox basically, if the muscles are also involved with the nerve, then Macfox works very beautifully. But in every case, to prescribe Macfox would not give you results. So in this case, if you feel, you can think about a remedy called as Gaultheria. In expotency would work better in these cases. Welcome, Dr. Akshay, Dr. Alexander, Dr. Avni, welcome. Which remedies are more prominent for fear of vomiting? Whenever you are prescribing for vomiting, make sure, for example, case of migraine comes to us and the patient says, sir, migraine is so severe, whenever I feel that I have migraine, I have a fear now, the vomiting will come, and vomiting basically erodes my whole esophagus and I feel very uneasy, and then the whole tiresome comes. I just have fear of vomiting, but the cause is migraine. So anything primary disease that is important to treat, wherever I've seen in my practice, primary disease. If you take only just fear of vomiting, what will happen? The vomiting will be better and automatically some other fear will start. So in this case, if it is vomiting basically is out of control. Basically, it's syphilitic part when it is against the body. So when you're treating syphilitic cases, if you treat in parts, you are bound to get those symptoms sometimes in a violent state. So the remedies, if you want the remedies, I will give you the remedies also. The most important remedies that I have seen in my practice is argentum nitricum, arsenic, lycopodium. Of course, think about glonine and naxomic also, fear of vomiting. So please, remedies for Kandisha. Sir, the patient underwent surgery for nasal polyp in past. Now she's having nasal block right side and later on left, relieved by some allopathy sprays. After that, walking for some time. Please share remedies for this condition, sir. Nasal polyp. Now see, whenever basically you are prescribing for nasal polyp, after operation, after surgery, two or three things you have to remember very well. It is written that whenever adenoids or polyps are removed and the patient suffers from obstruction of the nose, the first remedy that you should think about is Kali Sulph. So do remember, Kali Sulph is a fantastic remedy. I also have used it a lot of times. The problem starts, where, because make sure that it is basically after the vomiting, after the surgery, or the patient had some symptoms of adenoids before surgery also. If the patient has suffering from adenoids problem before surgery also, then you have to add few more drugs with Kali Sulph, because Kali Sulph is the only important medicine. Then second, you must think about a remedy which I have told you before also, and the remedy is Hypoxaninium. HIPPOZA ENIUM. Kali Sulph, Hypoxaninium, Bratacarb, and calcareous iode. These are the remedies which I use in my practice. Okay. गुड आफ्टरनून डॉक्टर वैष्णव, डॉक्टर परवेश सर. मैं बिहार से आपके पेशेंट हूँ, इतना को काम की एक्सटेंड कर उसके. ओके, आई विल गेट बैक टू यू. ओके, अपन कर सकते हैं. Alexander says, is a child that has tummy ache, pain behind the navel. Okay. No, I have many more symptoms and swallowing increases the pain. Okay. Strawberry tongue. Thank you, Amulya. So, see, whenever if you have a case where the patient has classical, strawberry tongue, that is, yeah. So, strawberry tongue, if somebody asks me what is strawberry tongue, there will be a lot of anybody for strawberry tongue, which is the remedy? Whenever, if you think in homeopathy that you have described a fantastic case, a fantastic, strawberry like. So strawberry tongue, redness of tongue, you can say there are 3-4 remedies very, very important which are related to vomiting also. Argentum nitricum, it is there. Belladonna is there. Lachesis is there. Antium tart is there. Then you have phagopyrin also, you have aurum triphyllum also, and these remedies are there. But these 4 remedies are giving me very good results. So I think Argentum nitricum, in your case, Dr. Alexander, Lachesis is there and Belladonna is there. You have to differentiate between these 3 remedies and you'll crack the case. Yes, Belladonna is there. Right. Make sure that it is a classical strawberry tongue. You have basically sometimes red tongue also, and the remedy changes then. Scope in case of varicose vein, where venous Doppler studies show saphenous-femoral junction and great saphenous vein reflex. Oh, yes, we definitely have this. And mind you, Dr. Berawala, in this case, one thing is very important in your case. One thing was very important in case, reflux symptom. Matlab, this is what you call, you have to take into account whether the patient in SORA or any condition is very impulsive. In these cases, I have seen if the reflux symptoms of the patients are very impulsive or impatient type of patients, so you have to take into that account. What about Banajic protocol? I have never tried Banajic protocol, so I can't answer the question. Belladonna was given. So okay, you can try these 3 remedies then, Dr. Alexander, Argentum nitricum, Lachesis, and Belladonna you have given. C. And of course, then you can think about phagopyrin and aurum triphyllum also. Sir, acute sun-heat headache, which is not that throbbing type, amyl nitrate or gluonine, which helps more. See, when there is, when the throbbing is not there, both remedies you have written where throbbing is very much, throbbing is very much. So if you just want a remedy where the throbbing is not so much, then don't just think about belladonna, amyl nitrate and gluonine, because these both remedies have a lot of throbbing in their symptomatology. Then you can think about very, very, remedies which have less those type of symptoms. Then you can think about remedies like, you can think about muriatic acid, you can think about camphora, you can think about antium crude. Think about antium crude first, then camphora, and then euphrasia. Sir, acute, okay. Sir, any medicine for neonatal jaundice? See, it is also called as physiological jaundice, and it is basically because of that phenomena in the body that's why a patient develops jaundice. So, if it is not life-threatening, if it is not malignant type of jaundice, then just wait for some time. Just give the patient sun heat, and that should be fine in these type of cases. There's no need for medicine, and if at all, then you have that symptoms of malignant jaundice where it is not coming down only, then just ask the history of the mother rather than the prescribing only for the child, just by jaundice. Ask something about history of mother, and you can basically get that symptom in the patient, and you can prescribe very 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 properly. So but most of this I feel good would resolve down with light therapy and sunlight and all. So there is no need for medicine after all. If it is, then go with the mother's some symptoms in the fetal life. Thank you. Yeah. And still, if you feel that you want only some medicines for neonatal jaundice, then you see, basically, we have a lot of medicines where in newborn you can prescribe and think of. First thing, you can think about China. You can think about what you call aconite. You can think about Bovista. One remedy which I have used in my practice and have got good results, but there was no symptom as such, that is Humulus. Humulus. Humulus lupulus. You can think about that remedy. Okay. Ethranas, welcome. Salam Zain, hello. I have a question regarding a very large fiber, 11 cm. Oh God. But first, I want to say that the patient is improving with belladonna. Thank you, Dr. Raha, for sharing the case, and good that it's working, and something constructive we're doing with YouTube and Instagram Live. 11 centimeter fibroid. In this case, basically, first, Dr. Raha, see what is basically the local symptom. Sometimes the fibroid has an irritating effect in the uterus or in the bladder or in the rectum. There are some pressure symptoms. So ask those type of symptoms, or the uterus is feeling very heavy, uterus is feeling hard. That local symptom, basically, where the pathology is psychosyphilitic, that is more important in this case. Otherwise there will be a problem. So these type of fibroid, and the main reason for you telling you is that whether I have cured these type of cases. I have had a fantastic case where the fibroid size was I think 18 into 16 centimeters, and the patient was cured. I took that local symptom and then cured that case. Welcome, Dr. Palak. Very obstinate 40-year-old chronic IG level urticaria, multi medicines. How to approach? See, urticaria is basically what? Hysterectomy histamine, out of control itching. So make sure to understand the psychodynamics of the patient in this case. Why there is so much itching, why there is so much irritability, and why there is so much discomfort or disharmony in the patient's life that has led to urticaria. So do ask that question and you'll get the answer. Dr. Vansh, Dr. Moni Kumar, welcome. What is the chance of it shrinking as she is being advised surgery? Chances, if you ask me, I always say there is a chance in homeopathy, unless proved otherwise, I would say. If you could get me some local symptoms of that big fibroid symptom, we will be able to help and prescribe some medicines. Thank you, Dr. Vanch. Sir, person having glandular swelling for past 9 years, he can remember that he found this after he had got cold and cough. Person doesn't catch cold and cough easily. Okay, fine. Okay, Dr. Roy. So, Dr. Roy, yes, the patient is having a glandular swelling. Now, see what happens in these type of cases. I've seen whenever the patient has recurrent cough and cold, they take antibiotics, and then they get swelling in the submandibular region and all. This is called as reactive lymphadenitis. This is the body's reaction to the antibiotic effect, and that's why what happens, the patient reacts. In this case, first of all, it is because of suppression. So go to that rubric. Which rubric? As always say, go to that rubric metastasis. Because reactive lymphadenitis has resulted in that, and then see how is the lump, how is the node, it is movable, it is right side, it is left side, it is soft, and then try to describe in one sentence that, and then the patient's personality. You will see there are remedies like calcarea floor, antium crude, semesifuga, dulcamara, natrimur, pulsatilla, which can be prescribed in these type of personalities. When you have a no symptom, the patient feels fine, elderly patient, but the slightest exertion increases the heart rate, goes to 98 beats, but the blood pressure normal 120 by 70. So whenever basically you have patients where the heart rate increases, that means what has happened? Just don't take the pulse are very audible or pulse are bounding and all. Just take pulse are abnormal. That means the body is trying to show this part through the constitution is weak through this part. So we have very acute good remedies in this you can prescribe. First of all, you have only told that it is because of exertion. Now whenever you have exertion mentally or physically, both I would say, don't take only mental exertion, mentally and physically, then you must think about these type of symptoms. So if you say just when the patient gets excited, the pulse increases too much, we have fantastic remedies. Just first think about Naxomica, second think about digitalis, third think about petroleum, and one remedy which I have used very good in my practice is this only plain symptom of easily excited high pulse, that is Plantago major. Though it is very rare, but Plantago major has a very good effect in this type of conditions. Sir, headache on left eyebrow, before now it is right eyebrow and redness of that region, aggression morning. See, whenever the patient has headache left, now you can always, because you have taken the rubric very well and you have seen that it goes from left to right. If you go this type of, then you have 3-4 remedies which are very useful. But in your case, it is written aggravation after morning. Now, whenever you have pain, whenever you have a case of headache, and the patient says whenever in the morning, you must identify which part of morning. When he just wakes up from the sleep, then the pain is there. Or when he wakes up from the sleep, after some time the pain is there, because morning is a long time. And then morning, what time? It is 5 in repertory, 5, 6, 7, 8, 9, 10 is given. Just plain morning aggravation, then you must think with redness of there, you must think of 3-4 remedies which are very common, and that could help you in your practice. Think about Naxomica, think about Kali iode, think about sulfur, think about Thuja, and think about one more remedy, which is again very rare, but that remedy with headache normally has twisting of the eyelids, and that is Agaricus muscarius. Dr. Sangma, sir, I have a patient who says she don't feel good because she hardly has discharge from the nose and sneezing. Okay, if at all she gets some discharge from nose, she really feels. What a coincidence, one of my very close relative, he always calls me that I am having this problem, but I have not got sneezing. If I get one sneeze, I'll be much better. This is how the patient complains about this type of complaint, and this is very important symptom. Dr. Sangma, I really have that case where the patient comes and tells me, just एक बार छींक आ जाए ना, सब ठीक हो जाएगा. And his son also has the same problem. He tells me, एक बार बस छींक आ जाए ना, सब ठीक हो जाएगा. Write down the remedies where the patient has desire to sneeze. There's an urging desire to sneeze. Very important symptom. Do think about phosphorus, silicia, zincum metallicum, and sulfur. I have got very good results in this type of cases. One remedy which rarely I have used, but I have used where the sneezing is accompanied with lot of dryness of skin and lot of itching. Ichthyolum, ICTHYOLUM. Okay, I hope you got the answer, Dr. Mulya. So these are the very interesting symptoms, and sometimes the patient comes and tells you this type of sneezing, and the patient says कि मुझे पूरी छींक नहीं आती, आधी छींक आती है. Sometimes I used to feel very surprised and very surprised what symptom the patient is. आधी छींक आती, half sneezing. So there is a rubric for interesting symptom in our remedica, that ineffectual urge And then ineffectual efforts, it is said. I have got results with so many remedies, so many cases with the remedy Carbovagen, Calcarea, Flora, and Cilicia. This has given me very, very good results. So this is how you have to take the symptom in cases of these type of complaints. And when you have chronic tendency to sneezing, every time the patient is sneezing, do think about Cilicia. Dr. Palika, welcome. Okay, so you got and sneezing and all, it is important for you to cure, because if you are able to cure these type of complaints, automatically your basically practice increases. One thing, Dr. Pamela, which I have basically known in case of sneezing, I'll just take a minute off. You have to differentiate whether the sneezing it is with coryza or without coryza. This is the only thing you must ask in these type of cases. If the sneezing is with coryza, do think about arsenic album, do think about sabadilla, do think about justitia, and think about allium cepa. If the sneezing is without coryza, write down the remedies that will never fail in your practice: Calcarea carb, Euphrasia, Teucrium marum verum, sepia, and Carbovage. So this is important to differentiate with sneezing and without sneezing. This is very important, and that will be able to guide you to the remedy. I have a friend, she has bad sinus. Interesting enough, she got a bad infection just before exams, and again, same now, she's having exams. I'm thinking anticipatory anxiety remedies. So yeah, you can think about whenever the body faces a challenge, the patient reacts. You can think about you can think about in those lines. Woman 40 years continues diarrhea after antibiotics. GP doctor diagnosis inflammation in the rectum, anger and irritability in nature. Very, very surprising, Diarrhea continues. This is a very, very interesting symptom, and what do you call? If it is basically because of antibiotics. So if you have a case where the patient comes and tells you that it is because of antibiotics, two remedies that you have to think about is very, very important. The first is, of course, Naxomica, and second is Allosocretina. Or I could go more further and tell you, Dr. Madan, you can take one symptom, that is diarrhea, when it becomes chronic in nature, for whatever cause it is. Whenever the diarrhea is chronic in nature, then the remedy application changes. Then you can think about phosphorus, you can think about sulfur, you can think about acid phos, arsenic, and ferrum metallicum. Welcome, Dr. Razik. I hope you understood that. Of course, the patient, because of lot of diarrhea, has become very, very irritable and very, very what you call touchy and all. That would be there, and these are all covered by the remedies. So you have to understand and give these remedies either chronic or continuous. Either start with Naxomica. I can add one more remedy. You can take either Naxomica, Allosocretina, Abrotenone, because of that problem of antibiotics. And if it becomes chronic in nature, then the remedy which I have told you, you can think about that. Few questions on Instagram have been, I think, scrolled up, so I may have missed because I was just seeing the YouTube live. So if you have not got the answer for a question, you can always ask me. Okay. So I hope you understood that sneezing part of with or without coryza. Just two things you ask and you get the remedy. That's very, very important. In fact, whatever the coryza medicines are there, you can relate that to diarrhea also. Diarrhea during coryza. Dr. Madan, diarrhea during coryza. Then think about China, mercury, pulsatilla, and sanguinaria. Just to let know, we are restarting the biomonthly meeting second week May. Okay. Dr. Raha, biomonthly. Yes, we'll start that. So you understood that diarrhea, sneezing, and after coryza, there is diarrhea, or you can say diarrhea after coryza. Then also one of the important remedies would be selenium, Carbovage, Calcarea, and you'll be surprised, Rumex is also there. Up till now, I have told you Rumex, the cold air cough and covering the hand or covering it is better. But Rumex is also there when there's a diarrhea after coryza. So see how homeopathic symptoms and mathematics are so closely related. Just one symptom here and there, and the remedy, see how it changes. Again, I would like to tell anybody, just one symptom, not. It is basically your interpretation. That's so important. Cough from 3 months aggravate more while brushing. Gurgling with warm water, cough spasmodic, loud, white in color, and hard to expectorate. Also, rattling is present if patient does by self cough accumulation in the chest. In this case, there are 3-4 remedies that you should think about, Dr. Razik. First would be Naxomica, stickiness of cough. Second, you have to think of Coccus cacti. Second, do think about a remedy which is, again, maybe you have not read in your Mater Medica lot of times, but it is there. That is Baptisia. And fourth remedy that you should think about, then Kali's would be, Kali Bakram would be there. Okay. So it's already half an hour up, and Dr. Ladwani, Falguni, yeah, welcome. You have joined a bit late. We're just finishing our half an hour YouTube and Instagram live. So everybody, thank you for joining me, and meet you again on next Saturday for one more session of YouTube and Instagram live. Thank you so much.